Welcome to 10-Minute Wellness Tips. This is Brad Costanzo, and I'm here today with Dr. Eric Cobb. Eric Cobb is the creator and co-founder of Z Health, and he is one of the world's leading experts in harnessing the power of neurology of movement to create extraordinary change in the human body. Dr. Cobb's innate passion for human physiology and psychology began when he was first introduced to the martial arts as a 6-year-old boy, and his passion for the martial arts and all things athletic led him to dig deeply into the science of movement over the past 20 years. He's here with us today to share his tips with you. Dr. Cobb, welcome to 10-Minute Tips.
Thank you very much. I'm looking forward to talking to you.
What is the number one thing you'd recommend that people do to maximize their health and wellness?
Great. It's funny because whenever I got your email about this, I actually sat and thought about it for a long time, and I said, okay, what's the best information I can give? So I actually going to have to give you two different things.
That's fine. It's hard to encapsulate it all in 10 minutes, but
it absolutely is. So the way that I teach people is I say, listen, the human body needs to really do three things well. You need to see well, you need to balance well, you need to move well. I call those the pillars of fitness. But really, seeing well, balancing well, moving well require effort of us. And so the number one thing that I try and get all of the people that we train to understand is that, a professional's job, a trainer, a doctor, a therapist, our primary job is helping people change their habits. So whenever you ask this question, I thought that's a fantastic starting point, is to help people really recognize that if you want to maximize your health and wellness throughout your life, the number one skill that you really want to focus on is changing habits. And there's a lot of neuroscience around this now. We understand more about how the brain works. And there's a lot of resources out there as well. But if the way that I actually framed this for myself as I was reading your questions was, well, what do I tell my kids? And I have 3 kids, and the number one thing I tell them is that, success in any endeavor comes from a really critical focus on high yield habits. And we know a lot about how to form those now. So with regards to the first part of this question, it's that. And if people are looking for a very fast kind of entry point into this, number one thing I tell people to do is when you start thinking about habit change, you want to know, number one, what habits are the most important. Because losing weight, getting in shape, those are all formed by little decisions throughout any given day. And whenever you look at the science around habit change, one of the things that's becoming very apparent is that brains really like habits. They really don't like changing them, though.
Right. I can attest to that.
And so there's a very famous habit researcher at Stanford. His name's B.J. Fogg, and he has a whole program he calls Tiny Habits. And again, what we're learning is that if you're going to enact some kind of dietary change or exercise program, very often the key is shrinking the size of the change and effort that you want to make until it is ridiculously simple. Dr. Fogg uses an example. If you want to learn to floss your teeth, floss one tooth. Start off with flossing one tooth. And it sounds ridiculous, but the whole thing he's saying is that in order to floss that one tooth, you actually have to create an environment in which you're reminded that you need to do it. So, like I said, if people are in this seeking area of, okay, what do I do? I want to be healthy throughout the rest of my life. What's the very first thing I want to focus on? I tell people, learn to change your habits. And there's a lot of reading you can do around that.
Right. I did that a little bit in my own life when I was trying to get back into working out, when I'd taken a lot of time off and I just wasn't in the habit of doing it anymore. I had a gym membership. It was just so hard to pull myself away to the gym. So I just made it a habit of every single day I'm going to do at least 7 minutes at home. There's no excuse. I can do 7 minutes of push-ups and sit-ups and whatever just to get in the habit. And after maybe about a week or two, I was like, okay, boom, I'm used to working out again, and I went right into the gym because now I wanted more. So it was but for that exact reason.
That's awesome. And basically what you're describing there is you created this trigger event, 7 minutes. There's a great story around this. A very famous modern dance teacher years ago. She was well known for showing up to work out at the gym 2 hours a day, 6 days a week, and she'd done it for years. And someone asked her one time, they said, how is it that you've developed such an amazing habit of exercise? And she's like, no, I have no habit of exercise. My whole exercise program is based off making it to the taxi in the morning to get to the gym.
Exactly. That's the hardest part.
That was the only thing that she really had to focus on, was getting down there to meet that taxi. And so that's the kind of thing that I talk a lot about with people because everyone's life is so busy. We really have to create these small trigger events that we can focus on and have enough energy to do, and that can lead us into these larger habit changes.
Right. Okay. So the habit changes are really the part one of
Yep.
how to maximize your health and wellness. What is part two?
Part two, and what I really want to talk about with you guys today is the power of working on your vision. One of the things that we're seeing throughout the health and wellness world, but also in the pain world, is just how important it is to maintain good vision throughout your life. When you do look at a lot of the research around this, and you look at what causes people to become less active as they get older, there's a strong correlation that we can draw between decreases in visual acuity and a just overall decrease in movement. When you look at the science around this or the neuroscience around it, I just tell people it's pretty simple. Your eyes lead your body. And so if your vision's deteriorating, it impacts your balance. If it impacts your balance, it's going to impact your movement. And if you, again, look at this, the way that we explain it to people is that your brain's primary job is to keep you safe. And if it is concerned that it cannot interact with an environment safely, it will cause you to not engage with that environment. So meaning, the simple way to describe it is, hey, if I can't see well, my brain may go, hey, you have knee pain today. You may have back pain. You may be stiff. You may, start avoiding playing those sports that you always enjoyed simply because you can't see well. Now, a lot of people, when I discuss this with them, have this very, what I call archaic idea about vision and whether or not it can be exercised, whether you can train your vision, because they may have heard from some well-meaning doctor years ago that, hey, after 40, your vision's going to deteriorate. There's nothing that you can do about that. And the fact is that's not true at all. We're learning more and more that with the appropriate type of exercise, intensity of exercise, you can actually train your vision. You can restore it pretty much regardless of age. In fact, there was a study just released a couple of weeks ago from, I believe it was in San Diego, and what they talked about is 1 week. Okay, it was one intensive week, but 1 intensive week of training made long-term changes in the visual skills of the people in the study, and the 70-year-olds in the study got just as much improvement as the 20-year-olds in the study.
Wow, that is remarkable.
Yeah, so that's the kind of stuff that we've been talking about for years. It's very powerful, and as I said, it's one of those things that because you are constantly quote unquote seeing, many of us don't recognize how it impacts the rest of our body over time because you're just habituated to it. But in terms of the way we prioritize stuff in our system, I always tell people, listen, we're going to work on your eyes. As your eyes improve, your balance will improve. As your eyes and your balance improve, it will make all of your movement much easier. Because your brain will feel like you're safer.
So pain starts to dissolve. Is that one of the benefits?
Yeah, this is one of those weird areas where people look at me like I'm crazy. They're saying, you do eye exercises and my knee pain might get better? And the answer is yes. We've seen it thousands and thousands of times.
So sorry to interrupt, but these eye exercises, I am familiar with them because I've actually done a lot of them. But you're not talking about, obviously lifting weights with your eyes. There are various movements, right? Various movements and patterns and things that you do that activate the visual stimulus. Is that how that works?
Yeah, so the way that we describe it, your eyes really, you can look at them in two ways. You can look at them biomechanically, which means that your eyes have muscles. And most people get the idea that if you never fully stretch or contract a muscle, it will get weaker and stiffer over time. And so, number one, most people never really train their eyes through full ranges of motion. So we do have muscular components, but then you also have the neurologic component of what are you actually seeing, what is that doing in the brain? And in both cases, different eye movements and patterns, as well as different visual tasks, like learning to see at night or improve your peripheral vision, those also can play a pretty strong role in how the rest of the body is going to respond.
Yeah, it's counterintuitive, and I imagine you get a lot of skeptics, but when people do that, I notice that I had changes in my own workout, the way I felt in the gym. It's something that I do every single day, and the things you teach at Z Health seem to be very approaching the body like an entire system that's interdependent upon the things that a lot of people neglect. So I like that.
Well, I appreciate that, and that's one of the things I say a lot is that Z-Health is really a holistic system, and I don't like using that word because it has this flavor now of being very alternative.
Hmm.
When in fact, if you look at the brain and body interaction, everything is holistic because when I change the brain, the rest of the body has to follow.
Yep.
And so, yeah, we look at some of these smaller, what many people consider smaller subsystems of the eyes and the inner ear, because the reflexive control they have over us is really profound. And so we can sit and diagram out all these neural pathways for people, but at the end of the day, it really comes down to what you're experiencing, which is, maybe I have shoulder pain, I do a vision drill, and all of a sudden my shoulder pain goes away. That is very exciting, and it's funny to me. After all these years, it still makes me laugh sometimes when I actually see it happen because it's very cool.
That's great. So where do people get more information on you and these programs? Where do they go?
So the easiest way to find out more about us is to go to our website, which is zhealtheducation.com. And particularly since we're talking about vision today, we have a product called the Vision Gym. And it's exactly what it sounds like. It's a follow-along training process to help you evaluate, number one, your own vision. And then number two, based on the evaluations that you're doing, you can then pick out or assign specific drills that you can use to work on either the mechanics or the neurologic part.
Perfect. Well, I encourage everybody to check you out, and I want to thank you for sharing that with us here today, Dr. Cobb.